So today we're gonna talk about GERD, that is gastroesophageal reflux disease. Okay, so talking about its GERD, what is GERD? So GERD is basically occurs when stomach acids repeatedly flow back into the tube that is connecting mouth and esophagus, mouth and stomach. So between the mouth and stomach there is a tube, that is food pipe, known as esophagus. Okay, and the connection between the esophagus and stomach is through sphincter called lower esophageal sphincter. Now in the normal conditions, when food enters through the esophagus to the stomach, the sphincters closes and the food that enters into the stomach can't regurgitate back into the esophagus. So this is the normal conditions, right? Now in the GERD conditions, what happens that when food enters through the esophagus to the stomach, and during the sleep or during uh, as people have, or as the patient have all taken lots of food, or food is not emptying from the stomach, so the acids that present inside, or food particles that present inside the stomach, are regurgitated back into the esophagus. The acids regurgitate back into the esophagus. Now we talk about its causes, that what are the causes that leads to this problem. So very first one, the problem, the cause is that weakness of lower esophageal sphincters, that is LES. So here we have seen that uh, lower esophageal sphincters weakness, the very first one cause, which here given that which is the ring muscles that bulge between the esophagus and stomach. Okay, now the second cause is hiatal hernia, that is where the upper part of stomach and LES moves above the diaphragm. So in hiatal hernia, what happens that, so as we know that the esophagus, that is the respiratory parts, and the digestive part, that is stomach, they are separated by diaphragm, right? Through so the diaphragm, below the diaphragm the stomach starts. Okay, now in the hiatal hernia, what happens that in some parts of that upper parts of stomach shifted into the above the diaphragm. So here it is, here the diaphragm is, and in the normal conditions below the diaphragm the stomach is starting, but in the hiatal hernia conditions the stomach upper parts are, here we can see, shifted upward to the upward of the diaphragm, right? Now also the causes, that is pregnancy can causes uh, that lead to increase in the pressure in the stomach, and which causes the reflux of acids back into the esophagus, that lead to the GERD. Okay, also the obesity, which can increases pressures on abdomens, and already we have talked about the weakness of LES. Also the smoking and alcoholisms can lead to the GERD. These are the causes. Okay, now here some few more causes are there, that is non-steroidal anti-inflammatory drugs like ibuprofen, aspirins, naproxen, some muscles relaxants drugs, similarly blood pressures medications, and the drugs that are used in the osteoporosis, that is bisphosphonates, are the cause for uh, GERD. Now, some antibiotics, potassium sulfate, sedatives, and antidepressants also leads to GERD. That their prolonged usage leads to cause the GERD. Now, talking about the sign and symptoms for GERD, that mainly includes that a heartburn, that is sensation in the chest and throat. Now, regurgitation, we already discussed about it, that acids backing up into the throat or mouth, and then the next sign and symptoms is chest pain, now difficulty in swallowing, dry cough, sore throats, hoarseness of or voice changes, feelings like lump in the throat, chronic cough, asthma symptoms are also seen in the GARD. Now GARD leads to cause problems in the teeth, that is due to the acids erosion. So acids, the stomach acids that flow into the esophagus and occasionally reaches to the mouth due to GERD is highly acidic, okay, and these acids erode the enamel covering of the teeth, that is uppermost covering of the teeth, so making them more susceptible to decay, okay. Similarly, the dry mouth, GERD lead to dry mouth, which reduces saliva production. Saliva helps neutralize acids in the mouth and wash away food particles, so reduced saliva flow can contribute to tooth decay. Now we talk about this. Now we talk about diagnosis, that how we can know that a patient is suffering from GERD. So different tests has been done to confirm. So the very first one is like medical history. The doctor will take medical history and risk factors of GERD, they can analyze. Similarly, the physical examination, that is a physical examination may be conducted to look for a sign of GERD and related conditions. Similarly, most important is upper endoscopy. So the procedure involves inserting a flexible tube with a camera, that is endoscopes, down into the throats to examine the esophagus and stomach for sign of inflammations or damage. Now next important is pH monitoring. So they can monitor the pH of the acids that is present in the esophagus as it has refluxed back from the stomach. Now the test measures the amount of acids in the esophagus over a 24 hours periods to assess the frequency and severity of acid reflux episodes. Now talking about the treatment, that what are the treatments given to the GERD patients. The very first one is the doctor will suggest that lifestyle changes. This can change includes maintaining of healthy weight, avoiding trigger foods such as spicy or acidic foods, not eating close to bedtimes, elevating the head of the bed, and quitting smoking. Now dietary modifications, like eating smaller meals, avoiding trigger foods, reducing intake of caffeine, alcohols, and fatty foods. Now about medications, they are these patients are given the medications like antacids, S2 receptors blockers, and proton pump inhibitors. So the proton pumps inhibitors are given so that they can reduce the acid productions. Similarly, the antacids are given to neutralize the acids present in the esophagus or stomach. Now surgery are last options for them to cure this disease. So surgical procedures like fundoplications, may be considered to strengthen the lower esophageal sphincters. So the main problems, as we have already seen, that the main problem is with the lower esophageal sphincters, right? So there is a procedure called fundoplications, in which the upper part of stomach and are folded and stitched, uh, which 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 functions now as uh, type of sphincter or valves, which does not allow the stomach the acids that are present in stomach to reflux back into the esophagus. So surgery are also done. Now last is monitoring. So the doctor will uh, suggest the patients to for a regular follow up with a healthcare provider to monitor symptoms, adjust medications, and access for any complications is important in managing GERD effectively. So this much for today. Thank you so much for your attentions. Thank you.